Hello viewers, I am Dr. Shaileshkumar Garge, Citi Vascular Hospital. Today we'll see what are the causes and reasons for these fibroids. Who are the patient at high risk for developing these fibroids? So let's start. So the most important reason is familial. These fibroids, they usually run in the family. Suppose if the patient's mother, grandmother, auntie or sister, if they are suffering with the fibroids, they have fibroids, multiple fibroids in them, then it is more likely the patient can also have the fibroids and it can grow and cause symptoms in her. Second is the genetic. Depending upon the genes, sometimes some patients are more prone for developing these fibroids compared to the other. Third is the age. So as the age increases, the fibroids are likely to develop. So we usually see these fibroids between 20 to 50 years of age. If a girl develops the menarche, that is start of the menstruation early, so they have the more risk. And then if the patient is having late menopause, then also they have a more risk of developing these fibroids. So we usually see between the age of 20 to 50. At the age of 20, the risk is 20% only. The chances of developing the fibroids is less, that is 20%. But by the age of 50, the risk increases to 50%. So that means by the age of 50, almost 50 to 80% of the women, they have the fibroids. They may or may not be having the symptoms, but on a routine scan we find these fibroids in them. So as the age increases, the fibroids are likely to develop. The fourth one is the overweight or obesity. Why? Because those patients, those who are having more weight or obesity, they have more of lipid cells, that is fat cells, and these fat cells, they produce more of the estrogen, which is one of the main reason for this fibroid growth and increase in size. So the fifth most important thing is the hormonal imbalance. So the patients who are having this imbalance of this estrogen progesterone hormone, those patients who are producing more of estrogens, they are more likely to develop these fibroids. Why? Because estrogen and progesterone are the two main female sex hormones produced by the ovary. But in some patients, due to some conditions like PCOD or their overall health, there is dysregulation or imbalance of these hormones, and these are the two main reasons for the growth of the fibroid. That is why in the pregnancy we see these fibroids have grown suddenly, the new fibroids are formed, and the old fibroids, they grow in size. At the same time, after menopause, that is stoppage of the menstrual cycle, most of these fibroids, they shrink or disappear. So that suggests that these fibroids need a stimulus of the hormone by the estrogen. So whenever in your body, if the estrogen levels are going high, there is more likely that you can develop the uterine fibroids. So the sixth reason is the diabetes. So diabetes is one of the main reasons. Same again, in these diabetes patients, the more of the fat, cholesterol will increase, and they are more likely to develop the fibroids. The seventh reason is the vitamin D deficiency. So vitamin D is considered to be an anti-fibrotic hormone. So if your vitamin D levels are deficient, so you are more likely or high risk for the developing the uterine fibroids. So that's the reason most women with these fibroids, we have seen that they are deficient in the vitamin because they stay at home, they are not exposed to the sunlight. So most of these women, around 80% of the women, they are deficient in these are the women, they are more likely to develop the uterine fibroids. The eighth reason is the stress. So stress is considered to be the stimulus or considered to be a risk factor for these fibroids. So whenever there is work stress or family stress or some other stress, your body tend to produce the hormone which can control the stress effect, and these hormones will stimulate the growth of the fibroids. So if you are having work stress or family stress, then you are more likely to develop the uterine fibroids. And the ninth one is the diet. So diet is plays a very important crucial role in the development and growth of the fibroids. So that's the reason we see this fibroid growth and symptomatic fibroids in patients who are consuming more of the mutton, that is red meat, and those patients who are having or using the smoking and alcohol. So these are the patients who likely develop. At the same time, those patients who eat very less of green vegetables, fruits and dairy products, they are also more likely or prone to develop these uterine fibroids. So these are the few common risk factors and causes for the uterine fibroids, and hope you got this all cleared. If you have any doubt or comments, please put them in the comment box. We'll get back to you. Thank you. హలో వ్యూవర్స్, మన సిటీ వాస్కులర్ సెంటర్లో మన సబ్స్క్రైబర్ అయి ఉండి అఫోర్డ్ చేయని పేషెంట్కు మనం ఎవ్రీ మంత్ ఒక ఫ్రీ సర్జరీ చేస్తున్నాము. సో మీరు చేయాల్సింది ఏంటంటే, మీరు సబ్స్క్రైబ్ ఉన్న స్క్రీన్ షాట్ని కింద ఇచ్చిన వాట్సాప్ నంబర్కి షేర్